recording, and then you can start when you feel ready to so.
Yes. A warm good morning, good afternoon, good evening to everybody who's listening to the talk. Myself, Dr. Imran Pasha. This is my university, Yenepoya deemed to be university from Bangalore. And I have done my FAMA fellowship from Mahe Manipal on interprofessional learning. This project is about the what I've carried about in Mahe Interprofessional Education unit. So this is implemented in our university. Well, when I started about doing this project, the problem what I was looking at was, as we all know, dental profession is always practiced in silos. And I, come across, because majoritively my way of working is being interprofessional, or basically, we combine with medical, dental, nursing, physiotherapy. Most of the problems, nowadays are very complex. So I try to involve many of the faculties, but at the end of the day, whatever comes, we are all practicing in silos. So I thought, let us go about and do the, starting the Department of Dental Education at my university and strengthen this, through interprofessional initiative. So that's how the idea came about. And my coordinators at Mahe, they agreed. They said, yes, go ahead. And at my university, I had a very good support. And I think the Dean, Dr. Shripati Rao and Dr. Akhtar Hussain, sir, they said, okay, go ahead, let's do it. So this is how this Yenepoya Dental Education Unit came about, and an interprofessional educational initiative, because we had a team set up with medical, dental, nursing, physiotherapy. All people joined together when we when I had this idea, when I said that, look, I want to do this, and this is how it is going to work. I need your support. So I roped in all of them, and we sat together and prepared the bylaws. One component of that was interprofessional education. So I involved all the other faculties of all of the professionals. And in fact, community medicine department, Dr. Abhay Nirugude, and from the Dr. Leena from the nursing college, and Dr. Ludraj from the Yenepoya Physiotherapy College, they all came together, and they were all, promoting, they were telling, let's do it. That's the first thing, which started. Then I thought, it's going to be easy for me, it's going to be like a cakewalk, because I have convinced my management and I have convinced my university, and I thought, all principals are on board. I thought, it's going to take off like a rocket and I'm going to reach the sky. This is what, I started, started believing in, and started dreaming about when I started this project. Well, when the issue came about, what we have in our curriculum is multiple. Very many of them are organizational level, some of them are faculty, and some of them got to do with the specialization. With the increasing specialization, we are finding it very difficult to work interprofessionally or collaboratively. And if I have to look at my curriculum, there were 5 major reforms which had taken place in the dental curriculum, which was by our parent Dental Council of India and regional health universities. And to understand our setup, in India, we have, most of them are private dental colleges. We have 320 dental colleges, currently, and very few government dental colleges we have. And most of the practice is taught in silos. This is the basic issue what we have with the curriculum. So I thought, why not get interprofessional education, which puts other branches in. And this also helps the other branches also to understand how dentistry works. It's not just a drill, fill, clean, and send them back. It's all about, we are treating a patient who might be having a lot of issues. One case, today's presentation about Alzheimer's. What do I do when a patient with Alzheimer's come to my clinic? How do I tell my undergrads? How do I tell my postgraduates? What are the things or the issues they have to look in for when they're treating such conditions? Now, I took that as a basic example. It is a world of opportunity for us to develop, for us to understand the interprofessional education. So this was the idea when I started out. And well, the challenges were, consensus building among various departments, specialties including both medical and dental. And this was, I'll come back to it a little later on so that I can give you the insights. Dental course is 4+1 years, and curricular reforms very hard to come by, though our council and the universities do suggest, change the curriculum. IP curriculum integration as a main tool to come out of the practice of silos. This was the idea which I was selling it to them, that look, these are the things which we have not done, and IP would be an ideal approach for us. When I started my approach, as I said in the beginning, when all of them were agreeing, when I started going out, talking to people, talking to the departments, talking to different streams, there were a lot of interpersonal differences coming in. People thought, it's all about, how do people will learn about heart? How do we people learn about Alzheimer's? Do we have to take a theory class extra? Do we have to do these things extra? They were not understanding that, it's not about taking those classes to my students. It's about asking all the students come together, understand the patient, and come out of with a situation or a solution where they can work together and understand each other's role in a better way, so that patient is always at the better end of the care. So interpersonal differences cropped up mainly due to the hierarchy and the professional experiences, is what I thought. And also sometimes, I put it across as an age as also one of the important factors. And the problem was the fear of change. Example, losing hold on the specialization. That was also main challenge which I was coming across. Stereotypic rivalry, basically, me, I, how can you, why, and why should I? What's in it for me? The why comes what we talk about. What's in it for me? Why should I do interprofessional education? Already our, the schedule is such overburden. Now we are talking about interprofessional education. Maybe some of the points might be due to the power status what they have. These are the points which I thought about. And I thought, let me go ahead, the dental education unit may be able to address all this situation. Tell them, look, it's a win-win situation. Everybody has a role to play. It's not that, one person is going to take a role. It's about all other departments joining together. It's a win-win situation. I kept a blank space because, I'm still finding out the reasons and the challenges which can come across. It's been quite a long time. I started the journey. It's been 2 years when I've started this. 2 years of Yenepoya Dental Education Unit, and we have been able to do quite a bit of things. And what I have to point about this is a Calvin Coolidge sentence which says, changing college curriculum is like moving a graveyard. You never know how many friends the dead have until you try to move them. I found it really apt when I was preparing for this topic. It exactly looks like this when I try to do certain things at the college level as well. And how do I went about? I told them the bigger picture. See, the strengthening of the dental education will improve the society at large. And political is basically consensus building through changes done to the Yenepoya Dental Education, which help us chart out the growth. So in the phase one, I conducted the needs assessment where, I assessed the interprofessional education attitude, practice, and readiness to practice. And most of the faculties were, having heard it for the first time, their knowledge level, their attitude, and the idea to get into this was really low. And even then we went ahead and started the Yenepoya Dental Education Unit, and we conducted the first international workshop where Professor Dr. John Gilbert sir had come and given a talk, and Dr. Siraj sir had given the talk, and literally that was a change point where we created that workshop in order to create the consensus. At the end of the day, we had a panel discussion where principals from medical, dental, nursing, physiotherapy, pharmacy, all the principals got together, and we had people from a few of the international speakers also come in, join in for our panel discussion, where we openly discussed about what we are trying to do as an interprofessional education. Because people were getting confused when I was using the word interprofessional education, interprofessional practice, interprofessional collaboration. They were all like, what is he trying to do here? What is he trying to get into the system? What is he trying to get into us? It's going to be an extra burden. This workshop set the pace, trying to allay all their fears and telling them that, look, we are not going to change the system much, to a larger extent. It's going to create a system where people are going to come, learn about each other, and try to respect each other. So this workshop in the phase 3 really helped me to set the pace. In the year 2019-20, we did the workshop. It really helped. And from then on, the IP curriculum development, I focused on, I said, look, I need some type of, the leverage. Basically, what happens is these are all voluntary type of involvement. We did not have any Dental Council of India or the Medical Council of India or the nursing councils or physiotherapy councils mandating for interprofessional education. So I thought, look, if I need to move with this interprofessional education, I need to do something. So I got hold of my head of the department. I said her that, look, ma'am, this is what we have to do. We all came aboard and we said public health dentistry. which talks about community involvement and taking care of the community health. We developed the curriculum and we passed it through our the board of studies, and we put it up to the university. And well, there it was a game changer. The university, when they heard about our curriculum, the academic council, they gave us a full go ahead, and they told, look, this has to be not only to be done in the Department of Public Health Dentistry, the entire university, entire constitutional colleges should develop such projects. So that was the academic council's minutes of the meet, which was shared with me, and I was given the responsibility of developing the module. I said, look, this circular may not be enough. So I joined my PhD in interprofessional education, where I'm trying to develop the geriatrics model. And I know I've joined the curriculum course, which is run by ma'am at Sweden University. It really helped me, get my project together, and I'm still finalizing my few things. That one, I think that 1 and a half month of course material, whatever attended, and few talks which I've attended, really allayed my fears here and there. So I'm talking about what has happened after that, during in my PhD. It really helped me, try to put all these things together. Now, why all these things are important? Because it's not easy when we talk about trying to get these curriculum in pushing into somebody's ideas, when the regulatory authorities are telling it need not be done. We have one sentence where it says interdisciplinary, and people tell we are already practicing. Look, the simple example I would give that we have a system where they put a different profession, get them to one classroom, they talk about dental caries and dental treatments, and they think that that is interprofessional education. Well, it's hard time to tell them, no, look, it is not interprofessional education. It's there, it's just like a seminar or a lecture where you're just telling them about what dentistry has to offer. It is the students whom we have to put them together, and the faculties who have to come together. They have to act as a facilitator. Well, it's a long road ahead for me in my university or in my college. But let me tell you one point, that whether it's at the top level or at the college level, or at the students level, all of them are understanding this IP, interprofessional education, and the module. And we already have around 2 to 3 projects, student developed projects at various levels. One of them is at the SRB level, that is the research council level. 2 of the projects are at the ethics committee level. So I'm hoping that all these projects, and when my students go out and present all these findings, it is going to make a difference. So one best thing which came out doing this education unit was the curriculum, which was integrated into my postgraduate syllabus, which really helped. And also, since we are part of Dental Council of India, I understand that Indian Association of Public Health Dentistry also has included interprofessional education as one of the mandatory requirements for public health dentists to pass through. So we have been able to achieve a lot of in a small baby steps through the Yenepoya Dental Education Initiative. What I want to tell was, it's not easy for an individual or a group of people to bring in a change until unless we have the kind of support what is required, basically at an administrative level, and then it becomes easier for us. So this is what we have been able to do from the Yenepoya Dental Education Unit as far as interprofessional education is concerned. And I'm also still working, and now I know that whom to approach. Let me know. Now I have got a lot of good networking this one, and definitely will be approaching all the 3 other faculties to come and deliver the talks. The idea was basically practice guidelines, conduct workshop, make IP internalized within the students and the faculty, and develop something called as an IP champions within the university, who will take care and who will run these projects, in a self mode. So I'm looking forward to the progress which will be made through this unit. And in conclude, the recommendation is make an effort to include the IP in the university curriculum. It really helps. This is what I thought the others should know. And IP champions, creating IP champions who are in turn going to be acting as a change agents. They can be either faculty or the students. It can be both the ways. What I did in my interprofessional project for my FAMA fellowship was the faculty development program. As a part of the faculty development program, I thought if I have to improve the interprofessional education at my university, it is my faculty who needs to know about this concept. So this is how I went about doing this project. 3 years down the line, it's going on really well. I think this was my experience about establishing the Yenepoya Dental Education Unit and bringing about a change through interprofessional education. You can send in your queries. I'll be more than happy to answer to any of the questions which anybody might have. Thank you.